So I think in answering this question, we have to divide people still in the early phase or in the mid stage, in which I would say the major advancement has been the introduction of a quite effective COMT inhibitors for people developing fluctuation from the beginning of fluctuation or pick up on, and which has been a nice addition to what already we had, apart from Levodopa, dopamine agonist, and MAO-B inhibitors, and so on. And secondly, I think a nice addition for people in this mid-stage developing early fluctuation will be this new IPX extended release formulation of Levodopa, which has been already marketed in the US and is coming very soon also in Europe, which will allow a more stable levels of Levodopa in the plasma, and because of that will allow a better control of motor fluctuation, at least when motor fluctuation will start. So I think this is for the early and mid-stage Parkinson's disease. Obviously for the advanced Parkinson's disease patient, we have a lot of new possible treatments, going from infusions, and a nice addition from what we had before. We had already subcutaneous apomorphine, we had already intrajejunal duodopa, but recently we had the addition of subcutaneous foslevodopa, foscarbidopa, which works well, is much less invasive than the previous duodopa, because you simply need to have a subcutaneous continuous infusion. It's usually quite well tolerated, and the results are quite interesting. And obviously for the patient in such an advanced stage of the disease, it's quite an advantage to be proposed a subcutaneous infusion instead of intrajejunal infusion. And then going to surgery, we have more and more advancement in the field of DBS, directional leads, the new techniques for surgery, frameless, adaptive DBS. We hear today about advancement in this field, which can improve the already very good results obtained with DBS. But then, in the last few years, we had also an increasing role for MR-guided focus ultrasound, which is an incision-less technique, so apparently less invasive than DBS, but able to obtain probably in selected patients similar results. So much more acceptable for patients, and especially for people having a very asymmetric disease, using only on one side focus ultrasound is a good alternative to DBS and much more acceptable to patients.